Now I'm going to talk about a few aloe-based products. There are various activities that have been approved. There are internal and external uses. I want to briefly talk about the mechanism of action, which includes immune system stimulation and cellular communication. One of the first products I made around 30 years ago was Carrington or Kerosene hydrogel wound dressing. This was the first hydrogel of its kind, and it was #1 in the nation for 15 years. You can see on the label, it's a non-oily hydrogel for the management of radiation dermatitis, diabetic ulcers, foot ulcers, surgical incisions, first and second degree burns, and on and on. And to get these indications, you have to meet with FDA, send in the study evidence, and ask them for permission to use these for those indications. So this was the first product, and this was easy to develop because you don't have to worry about absorption, distribution, and elimination. You just talk about what happens when you put it on the skin topically. And since we had started by showing that it helped pieces of skin grow, then it was easy to get approval for Carrington wound gel dressing. The second product is we knew that it worked as an immune stimulant, and the USDA had developed a vaccine for Marek's disease for chickens. And Marek's disease is a herpes virus that causes lymphoma in chickens. And when it gets into the chickens, it spreads throughout the chicken house very rapidly, and when you bring your chicken in to slaughter, if that happens, then the meat inspector recognizes it immediately. They stop, they kill all your chickens that are there, they sterilize the facility, they go out and burn down the chicken houses, gather all your clothes that you used, and burn those, because this is such an infectious disease, it just wipes out a whole chicken industry. For this reason, the USDA had been working on a vaccine that would give them about 66%, 70% protection. You have to get 88% protection in order for a vaccine to be effective or better. And so I thought, why not try Acemannan as an immune stimulant? And we were able to get 95 to 100% protection almost immediately. It didn't require multiple vaccinations like a lot of vaccines in the past. So it was named ACE1, and it was sold by Solvay, and they called it the biggest thing to come along in years. We vaccinated hundreds of millions of chickens, and I haven't heard of any outbreaks for years. So, it's real good. It's kind of like being in the iron lung business, though, for polio, and then there's no longer any polio. So it was nice to make that contribution, but that certainly is proof that it stimulates the immune system. This was another product that we developed. It was approved for as an immune stimulant, and it's used in the treatment of fibrosarcomas in dogs and cats. And we first started developing this in horses. That's because I wanted to look at it for AIDS in human, and horses have sarcoids that are the result of a virus that's very much like human immunodeficiency virus, except this is equine immunodeficiency virus. And a lot of AIDS patients initially got sarcomas very similar to what horses got. Well, we treated our first 2 horses successfully. It was interesting. We could inject 1 or 2 tumors, and in 6 weeks all of them would fall off. And we were very excited about it, but when we talked to USDA, they said since a lot of our Spanish population eat horse meat, we're going to have to treat it like it's edible meat, and that required a lot more work. So we went from horses to dogs and cats. But this product's still on the market. I purchased some from my veterinarian. It first came, as you see it packaged here, and I'll take a minute and go through, how this, what this looks like. Talk to you a little bit about it. So these products had to be reviewed by the appropriate government agency. You go through and you do what studies they want, and then they allow you to market it, and they give you a license. Like this is U.S. Vet License number 384. So for more information, go to McAnallyassociates.com.